Non-operative management in the age of the pandemic. We can learn a lot from fables. The story of Prometheus. Prometheus was one of the Greek gods, or a titan to be exact. He was the creator of mankind. He stole the secret of fire from the gods and gave it to man. And for this, he was punished by the gods. The gods chained him to a rock. Every day, an eagle came and ate a part of his liver. Then, his liver will regenerate, and the process went on for many years. So, did the ancients know that the liver could regenerate? That it could heal by itself? The body has a tremendous ability to heal by itself. In fact, most solid organ injuries do not need to be operated upon. Here you see the liver is shattered, but then it will heal by itself. Here the spleen is broken in two, but 60% of them will heal by themselves. And with angioembolization, many cases in fact do not need to be operated on. The same goes for the kidneys. The urinomas or urine collection can be drained later on, percutaneously if necessary. What is a blush? Blush is arterial bleeding. It is often high-pressure bleeding and often 10 times the pressure of venous bleeding. But fortunately, it is less common than venous bleeding. Venous bleeding usually stops by itself or by packing. Here you see a blush in the spleen. This is arterial bleeding, and it usually requires surgery or angioembolization. This is arterial bleeding coming from the pelvic angiogram. The bleeding is probably coming from the islet vessels. It is difficult to operate in the pelvis. And therefore, angioembolization is a much easier option. Arterial bleeding can only be stopped surgically or by angioembolization. However, angioembolization requires trained staff. It can also be done on the cheap by trained surgeons using the II machine. Angioembolization requires embolic agents like gel foam or coils. Gel foam is temporary, but coils are permanent. Another example of trauma being managed without operation. This is a myeloma a collection of bile, and a complication of a liver laceration. It can be drained percutaneously without the need for surgery. A large duct that is leaking can be stented.
This is an on-table retrograde cystogram of the bladder. It showed an extraperitoneal leak of the bladder. The urine can be drained percutaneously without an operation.
Then there is retroperitoneal arterial bleeding, many of which may be inaccessible to the surgeon. You may need the interventional radiologist to stop the arterial bleeding. So examples are lumbar arteries, intercostal arteries, inferior phrenic vessels, adrenal arteries, and so on and so forth. When there is stenting, the treatment can be non-operative. Example would be a blunt injury to a large vessel which causes an intimal dissection. Anticoagulation may be required in some cases.
Very often, you may have to cover a defect in a blood vessel with impervious graft, and this is associated with a very high success rate.
Sometimes you may need to cover a defect. Here you see a break in the blood vessel. This is a break in the subclavian artery. The break is bridged by a graft which is done percutaneously. It does not require any surgery. Then there is aortic blunt injury. This is usually a shearing injury associated with high-speed deceleration injuries. The vessel is torn from its attachments, and you can get it from a high-speed vehicle collision or a fall from height. What you see here is a hematoma of the arch of the aorta. The arch of the aorta is torn from its fixed point. This is usually fatal, but in this case, there is a contained hematoma. Again, this hematoma can be repaired surgically, but then involves bypass surgery and a very high mortality rate. But in this case, the interventional radiologist avoided surgery and put in a stent instead, hence avoiding open surgery. In conclusion, trauma can often be managed non-operatively, and it may be wiser to manage non-operatively in a pandemic situation. However, surgery remains an option in a life-threatening situation, and interventional radiology remains a viable alternative.